Hello, my doctor friends. Are you planning to visit a cyclone affected area to provide healthcare services? Or you are sending your staff? Or you are some volunteer who are voluntarily visiting to this cyclone or any disaster affected area? So, today we are going to talk about the various aspects of uh, volunteering in this kind of areas. I want you to watch this video completely, even if you are some healthcare professional. Because by following these precautionary measures, you are not going to just safeguard your own health and life, but you are also going to help and safeguard the victims of this cyclone affected area or the flood affected area. So watch this video till the end. My name is Dr. Nitin and I create various tips, tutorial ideas for helping doctors to grow their clinical practice. And today I'm coming up with this special topic because I see many healthcare professionals, doctors, nurses, and volunteers visit this kind of cyclone affected area and they are carrying this risk not only for their own health but the people who are there wanting to help the victims of this cyclone or some disaster affected area. So to safeguard their health and life, I have created this special tutorial. I have researched some aspects which are necessary to discuss in today's topic. So if you are new to this channel, please subscribe to this channel. And even if you are volunteer or some healthcare professional, please share this video with as many as people you know, because it's going to help not only the healthcare professionals, but it is also going to help the survivors of this kind of casualties. So without further delay, let's get started with today's topic. And I'm going to discuss various aspects related to managing this kind of relief camps. So we are going to talk about various precautionary measures for doctors and healthcare professionals in cyclone relief camp area. So to begin with, let's understand like who are the possible people who are visiting this kind of area. So you might be a doctor or medical officer on duty. You might be a staff nurse or any village health nurse or assistant. You might be health inspector, or you might be just a volunteer who is voluntarily helping for any health activities or maybe even non-health activities also. So you need to follow this certain precautionary steps so as to safeguard yourself and the, the beneficiaries of the victim area. So there are some health hazards which might be common in this kind of areas. So you need to be careful and prepared for this because you not even if you are a healthcare professional, you want to safeguard yourself and you want to prepare for these conditions because the victims uh, of those area might be suffering from this or some other conditions. So you might be medically prepared for this kind of conditions for your victim or the patient. So uh, common situation is the drowning because you are affecting the flood area. There might be chances of some electrocution. So you need to be prepared for this kind of accidents. You might experience yourself some injuries while working with this kind of patients, or the patient might be suffering from some kind of injury due to debris, some collapsing structures, or maybe even the flooding. There, there has been increased incidences of snake bite in flood affected area. You can encounter some animal bites also. And this is a very common condition, insect bite or vector-borne diseases, increase in the mosquitoes. This is very common in flood affected areas. So you need to be prepared and take precautions for this. Another common condition is the respiratory conditions or respiratory illnesses or respiratory infections are very much common in this affected area. So be prepared for this kind of conditions with your medical equipment and all the required medicines or the medical aids. waterborne diseases is one of the common casualties that's happening because water gets infected and uh, uh, appropriate drinking water is not available. So waterborne diseases are also common. Some of these include acute diarrheal conditions, include typhoid or even hepatitis, leptospirosis. Skin infections also are increase in this kind of areas. Eye infections also get increased in this kind of locations, flood areas or cyclone areas. So apart from this, due to unhygienic meal conditions, foodborne diseases are also at increase. And this is mental health challenges. These are uh, least noticed or ignored conditions, but which are very much prevalent. Post-traumatic stress disorder is very much common, not only among the victims of the area, but the volunteers who kind of visit this kind of areas because they look at the scenario and they look at the condition of the people. They also get this kind of mental disturbances. So you need to be prepared for this kind of mental shocks, and you should be ready to provide all the services for this kind of medical condition. So let's talk about certain precautionary measures which you can take not only to safeguard your own health, your staff members, but also the victims of the affected area. So first of all, you should be trained and your staff should be trained to handle this kind of situations. Do not send untrained staff because you can endanger their life, their health, and the beneficiaries or the victims of the affected condition, affected area. So always use the cyclone risk shelters because you don't want to risk your uh, health and life by the conditions which I have mentioned earlier. You need to carry adequate amount of medicines, vaccines, IV fluids. You need to carry all those things because you never know what the patient will require because this is not your regular OPD, but you know what are the most common conditions that I already discussed earlier. So you need to carry this medicine along with you if you are volunteering to this kind of location. So basically, you need all the emergency medicines along with you. You should carry some disinfectants because, as I mentioned, the infections are on rise in this cyclone or disaster affected area. So you need to carry this disinfectant. You should also carry insecticide because that there is increase in this kind of areas with infections and all other conditions or vector-borne conditions are high uh, present. Then you need to carry some hygienic food. I know it will be very difficult to maintain hygienic conditions of the food, but still it's your responsibility to eat hygienic food because you are going to help this kind of people. And if you get ill, you will need some kind of help and assistance. So instead of helping the victims, you are uh, solving the problem, you are creating more problems. So that's why you need to carry the hygienic food and carry the drinking water hygienic conditions. So practice all the hygiene and sanitation measures, whatever is required. Please do carry out that, and you need to use mosquito nets and insect repellent wherever you are staying or wherever you are working in this cyclone affected area. You need to make sure that the disposal of the waste and the whatever medical biomedical waste is there, you are disposing it properly because water is there, it is easily uh, like spread the infection through those waste material because most likely it's going to be very infectious in nature. And because of the flood condition, it is more prone to spread the infection because of decreased immunity. So practice regular hand washing, which is a very basic and very doable uh, measure that precaution that you can take, which will save your life and the lives of the victim of the affected area. To use personal protective equipment, e- even if it is fasting, please use that because it's very useful and it is going to benefit to you and the victims of the affected area. So if you feel these precautionary measures are uh, going to help you, please share this video with as many as people with possible, particularly the people who are visiting into this kind of locations, cyclone affected area or disaster affected area, who are volunteering, irrespective of whether they are healthcare professionals or they are just non-healthcare professionals volunteering uh, to this kind of area, because it's going to save somebody's life. So please share this video, because it has been seen that the conditions or the aftermath of the disaster affects more people. It affects more uh, in, after the disaster had happened. As I talked about the infections and the vector-borne conditions, the casualties due to the actual cyclone may be very less, but the casualties and the healthcare impact after the cyclone or the disaster is much more than the actual cyclone. So uh, we want to stop that. And to stop that, we need to take these precautionary measures and be careful, be safe. So please share this video with as many as people possible. And if you are not subscribed to this channel, please subscribe to this channel. By you subscribing, it gives me motivation to create similar uh, tutorials, which will help to larger amount of population. So with this, I'll stop now. I'll come back with another tutorial. Until then, bye bye. Dr. Nitin signing out.